All right, excellent. Welcome. Good evening. I'm delighted to welcome you all to this event on improving basic services for the bottom 40%, lessons from Ethiopia. I'm Jean-Paul Faguet. I'm a professor in the political economy of development in the Department of International Development and not for International Development, which I'll explain in a moment. So welcome to all of you. We're very excited to see lots of new enthusiastic faces of new students who have just arrived at the beginning of the academic year here at the LSE. And welcome to all of you who are back as PhD students or undergraduates as well. I'm very pleased to announce to you our panel tonight. Let me start with Marta Foresti, who's Director of Politics and Governance at ODI. She has a disciplinary background in philosophy and logic, and she'll be acting as a panelist and discussant of the report, as will Peter Hawkins, who's Head of Profession for Program Management at the Department for International Development, i.e. the bilateral aid agency of the UK government. He is fluent in Amharic and spent a long time in Ethiopia and has a career spanning 30 years plus in international development. But our main speaker tonight, who will be presenting the report, is Qaiser Khan, who's lead economist and program leader at the World Bank and one of the senior figures in the office in Addis Ababa currently, although his work spans all of the world's developing regions. He's been in Latin America and the Caribbean. He's worked in Africa, of course. He's worked in Asia. He has a long career that actually began in the private sector, but then actually, no, that's not true. It began in academia. He was a professor of economics and then went into the private sector, but has spent a long time now working in development, which I think it's fair to say is where his heart lies. The ground rules are that Qaiser will speak for about 20, 25 minutes, and then we'll have discussants, and then we'll open the floor to questions. So without further ado, please join me in welcoming our speakers.
You always test out if the pointer is working. Is it working?
Yeah.
Anyway, let's hope it's working anyway. And then, so I'm glad to be here tonight and on a rainy night in London, which is a common night in London, I guess. But let's move, and I'm coming from a place which is been rainy for 3 months in Addis Ababa right now, so seems very similar weather at this point. Okay, so let's move on. I mean, the title, why do I say the bottom 40%? It's in the title. The story is partly in the title. The bottom 40%, actually the bottom 10 even more so, are the people who seem to get left behind as countries develop, right? So we're trying to learn some lessons that we can glean from some countries, and Ethiopia is one of them we're looking at. What kind of service delivery models can bring the bottom 40% and help them move ahead with, because at the end of the day, development is about giving people choices. But to have choices, you need to have your own human capital, education, health, all of that, right? So how do you make sure that the poor or the bottom half of the population get the same, at least access to service to the start at some starting point with other people? We don't know about the results. At least you need to have equity. Equity of opportunities is what we look for rather than equity of outcomes, right? So that's the first point. So let's go for, so basically the whole objective study in one word, we're trying to figure out the Ethiopian model, which is a decentralized service delivery model, is reaching the poor, it's reaching the underserved small ethnic groups, is reaching women and all the people who normally get left behind. So that's the purpose of the study, and we are able to generate a data set to look at it along with Jean-Paul, who is here, right? And two other people who are not here, who are right now traveling in Ethiopian region of Harar. So here's the regional map of Ethiopia. Ethiopia became a federal state. And a federal state has, you see some regions, it's really small. Harar, I just mentioned, is a little speck in there, right? But the federal state, these regions are fully autonomous and they have their regional governments, right? And below the regions, you also have waradas, which will be districts in other countries, right? And these waradas are responsible for basic services in education, health, agricultural extension, basic water supply, and maintenance of and provision of rural roads. So those are the 5 sectors that are fully decentralized at district level, which is unusual for many countries because decentralization to that level is not a common thing. The other thing with the Ethiopian constitution, I should point out, that Ethiopia is a multinational, multi-ethnic state. There are some very small ethnic groups as well. And one of the things the constitution allows is for even a small ethnic group could demand to have their own warada or district and then get control of the services at that level. So that's the federal system in Ethiopia. Okay, the total population is 92 million, which makes it the second largest population in Africa after Nigeria, which is the biggest. 98 ethnic groups, 93 languages. It has had it's the fastest growing country in Africa in the last 10 years and the 3rd fastest in the world, so growing at 10% per year. It has also made some of the most striking reductions in poverty, but poverty still remains very high. So I mean, while you say it's made reductions in poverty, it doesn't mean the story is over, you can go start. And it has made rapid strides towards reaching the MDG targets. Now, the MDG targets are targets, and they achieve that, but Ethiopia will probably need to go beyond those targets. So just to give an example, net child mortality fell to from 123 to 88 per thousand. Primary net enrollment rate rose from 68 to 82%. You see some numbers, gross enrollment over 100%, but that includes students who were over age. Okay, so as I said, it's a federal state, 9 regions, 2 cities, full administrative decentralization. About 850, 1,000 waradas official in the country, but about 100 plus of them are in the greater Addis Ababa capital region. So those have a different way of delivering services. So we looked at the 850 waradas. There's a program in Ethiopia that the Ethiopian government has been good at pooling partners into country-based systems and making them work through country-based systems. And one of those programs is the Promotion of Basic Services program. I have 2 colleagues, one on the panel, one sitting in the audience, who helped develop the program earlier on. But this is the largest donor-supported program in the world. It is implemented by local governments. The current phase is about $6.3 billion over 5 years. And about half the funds come from the government of Ethiopia, half come from development partners, of which the largest are in that order, World Bank, DFID, and the European Union in terms of large contributions, right? And these things, this program finances intergovernmental fiscal transfers. These are transfers going to the local governments. So it goes from federal to regional, regional to local. And the federal government has a formula under which they have to distribute funds to local, which takes account population and poverty and lack of development in the process. And regions have their own formula. Each region develops its own formula, and the funds go to the districts. Okay. So the World Bank, about 10 years ago, this is the 10th anniversary of that report, issued a World Development Report, which does every year, but the focus was how to improve services for the poorest. And that World Development Report postulated a model where you have to have accountability. So there are, for the poor people, and so there has to be several routes of accountability. The poor people, if you see on the left blue axis there, and the service providers are on the right, sorry. Oh yeah, you're facing, yeah, left and right. I'm just trying to get it right, okay? So you have to have accountable systems, right? So yes, you can have accountability from poor people through their impact, through votes on policymakers, and through policymakers and government requirements on service providers, which happens in countries like the UK, I mean in most countries, strong government. You can also have, in addition to that, some mechanisms under which the poor people can actually directly influence the service providers. And when both sides work, you get better results and more accountability to the poor. So that's the conceptual model, and the Ethiopian model is basically tries to develop that. So sort of, I would say, they're backed into it. So what are the models of, we know how governments work. Governments are strong, weak, whatever. So what are the models that allow citizen accountability for service provider citizen accountability? One of the things in Ethiopia is the financial transparency and accountability things. What we have, the government, all district governments, or what are the governments, have to publish their budgets. And they have to publish, the money they get, what they're spending it on, where they're doing it. And these have to be in the local language, right? So these are published in many cases on the web, but they're usually outside most government offices, right? And then citizens are provided training in how to react and deal with the budgeting process, right? So in addition to the local governments, service delivery, so in Ethiopia, 90% of local governments posted their budgets in public. In some regions, the citizens engage in active discussion. Now the government is thinking of moving to making all regions have active citizen discussions before they finalize the budgets, they get the allocation, right? And then 50% of service delivery units post their budget. Now service delivery units are schools, health centers, just to take some examples. Why this is important? About 10, 15 years ago, the World Bank did a study of public expense tracking in Uganda, found out less than 5% of what is supposed to be ending up at the school was ending up at the school, right? So by having the budgets out there, having the, people know what the school is getting, people know the staff they're getting, so there's some, mechanism of at least getting citizen knowledge on the budget process, right? So local government officials are being trained, and as well as citizens are being trained, and this is done in training sessions as well as radio, television. The second part of citizen accountability is what we call social accountability. Now, we know that Ethiopia went from feudal society to a very strong Marxist regime to a very strong regime now. History of people who feel they're not in that, who people may be afraid to express their views as directly. So what social accountability does is provide a structured way in which people can speak out without feeling they may be they would be intimidated. So what happens is social accountability, we have groups who are facilitators, mostly non-government organizations, civil society organizations. They will sit with service users separately, then with service providers separately, understand the problem separately, and then put them together in a situation where they help each other work out the solutions, how to improve it. So these tools in most countries have had the effect of improving results. The impact evaluation of that done in neighboring Uganda has shown at least a 25% reduction in cost or results or improvement in results, whichever way you look at it, right? That has the thing. So, and at the end of the process of social accountability, the service users and the service providers agree on a joint service improvement plan. Okay. So, I'm not going to go over the data, how we generated data, but all I want to say is that, yeah, we used administrative data, we have used survey data, we've used very independent surveys like DHS to cross-check the administrative data to make sure that we are, going in the same direction. And so we have been able to get data for, we did I said the 850 waradas or even 1,000 right now. 727 waradas is what we have in the sample, which covers the whole country. It covers, and because we did 727 because we needed some data which could only be done at the time of the census, and the last census, they had that many waradas, so we used that data to get that. For example, ethnic characteristic of a district, okay. So, for those of you who are not economists, I'm not gonna go over this. It's there in the book, and there's several more things in the annexes. But this is a form of equation that Jean-Paul and many others who have been working on decentralized service delivery have been trying to use to estimate estimate the impact of, of spending and other things on services. You see that, for those of you who know math, you see the natural log sign in front of it. What we do in econometrics, use natural log to take out extreme values and the impact of extreme values, so it makes it within a range. So extreme values or outliers get thrown out in the process. I'll leave it at that. Anybody more interested, we can chat later. Okay. Now, we said that the Waradas are given money to spend on different sectors, these 5 sectors. What do they spend the money on? If you look at that pie chart, 62% of the money is spent on education, 17% on health, which is primarily health extension workers and local health facility staff. It's all salaries. Agricultural extension workers, they spend 18% of these are called development agents. Their job is to help farmers improve their productivity. And 1% on road maintenance and 2% on maintaining water system. Reason roads and water are low, there's another reason. Water is mostly put together by the community. This is paying for the non-community share, right? And roads, the capital construction budget comes from the regional government, not from the local government. Okay. Now, results. That equation was estimated, and we can go into that. Now, what do they tell us? Expenditure per capita, which is so for example, $1 increase in spending per capita on education at the Warada level will increase net enrollment rate by 3.6%. That is a very good impact. $1, 20 Ethiopian birr. I mean, it's a pretty good impact given what he can do. We can also see that some would say somewhat tautological reduces teacher-student ratio. Now let's look at health. Maternal child mortality improves with increasing spending in health in the district level, right? So a $1 increase in per capita health spending will increase Penta 3 vaccination, which is it's a group of vaccinations done for children, by 4.9%. Access to antenatal care, which is care, parents taking their children, pregnant mothers going to see health facilities before they have the child, by 6.4%, and access to skilled birth attendants, which is going to a skilled birth attendant at the time of birth, whether a facility or a health extension worker, up to 11.3%. Now, those of you who understand, who know how mortality and health works, the first two will reduce child mortality, and the second two will reduce maternal mortality, which are pretty high still in Ethiopia. So these are very important ways to spend money. Okay. Now, agriculture, again, per capita increases in spending on agriculture service. This is primarily not on inputs, not on, it's just advice provided to farmers, right? So that has a significant effect on increasing output on most cereals and vegetables. There's no root effect on root crops, pulses, and oilseeds. When I was undergraduate, I was doing this pulses, so all these things I had to figure out what, we can explain later. I'm not going to go through and explain what each group is, right? But one crop you see, Enset, is a very Ethiopian crop. You'll not get that anywhere else. It's there. So it grows in a certain part of Ethiopia. Just other crops, I'm sure you see everywhere else in the world. Okay. Now, the other question we're trying to ask, is the money and the spending, the impact of spending getting to the poor? And for that one, we did the analysis. We found out that spending at the national level, which we did, and I didn't do it, our other colleagues did it, right? Of the bottom 40% receives only 33% of the impact of public spending in education and 34% in health, right? This is the whole country level, including the local districts, right? Now, we just look at the district level, the decentralized spending at the district level. 63% of the incidents fall on district spending on health falls on the bottom 40%, and 56% of that on on education. So local district level spending is definitely more pro-poor than national spending in Ethiopia. Right? Now, here we are, one of the things we try to do when you do analytic work, you have your database, you test it, then you test it in independent sources, see if the results you're getting are moving in the right direction. And those of you who know econometrics or know, the institution in the US does this demographic health surveys in almost every country in the world, every 5 years. And this data is very independently done on an independent national global method. And looking at that method, you can see that improvements in health outcomes have been across all quintiles. So they have the data across the 5 wealth quintiles. It's been improved across all quintiles. Again, we'd be arguing that this is because of the way Ethiopian spending for basic services is structured to get to the poor. Okay. And let's look at what is the impact of agriculture spending by wealth quintile. Now, from a purely econometric statistical point of view, the landholding quintile here is slightly richer than the wealth quintile because the poorest people, if you don't have land, you're not in this group, right? But you find out that the spending on agriculture extension workers has an effect on all landholding quintiles to take improved technology, whether it's improved seed, improved fertilizer, improved approaches to irrigation, right? So there's a positive effect. However, the effect is more pronounced in slightly higher up the distribution than lower down. And you could postulate a lot of reasons for it. Part of the reason could very much be the cost of inputs are more of a constraint for the poorer people than for so the wealthier farmers, you tell them you need to do this, they agree and they do it. Poor farmers then still have to find the money to buy the inputs. So that's something to think about as a question. And we looked at gender equity again, and gender equity, as you found out, again, the net enrollment rate did not look at health because all the 4 health outcomes were all targeted to women. So the health we did not look, it's almost tautological to look at the health one. But for example, if you looked at the impact of on male enrollment, compared that to female enrollment, the impact is slightly higher, right? And so there is a slightly more pronounced effect on increasing female enrollments. And then looking at the probability of field using improved farming technique by gender, and here the impact is not that great. In fact, it's negative for women farmers and positive for male farmers, right? So we are now trying to find out what causes this. It could be that most of the agents are male, and they do not talk to women farmers that easily. It could be the agents are focusing on certain crops, and then they do not, and they do not focus on crops that women tend to grow, which would be more food crops, generally in most countries. Or it could also be that the women farmers may have plots which are not as good. So any of that, but this is the impact on results. I'm not saying there's deliberate bias, but it could be the way the service is delivered has to be looked at. Okay. So the conclusions are, very much localized spending has a good effect on health and education, with the effect less clear for agriculture, but it's still positive. And it's pro-poor, benefiting the bottom 40% much more than regional or federal spending. The equity effect is stronger for health and education, less for agriculture. Gender equity is good for health and education, not agriculture. Okay, this targeting of lagging region works except for, okay, we pushed that slide into the back. Let me go to that slide. I didn't put it out. We have lots of slides we did not put out, but this is one slide. This one here, okay. This is a spatial variation of expenditures. This is important because part of the federal system was to set out to provide more, a pushed effort, a stronger effort for the more lagging regions and the more lagging ethnicities. And this result, as you see, it bears out that finding. The more lagging regions are getting more. There's one exception, Somali, but we found out the reason it's lower is because Somali is spending, we are using water level expenditures in this. Somali is spending much of its money at the region level. So that's one thing. They're paying salaries at the region level rather than at the water level. So that's one thing that has to be looked at in the future. So I go back to the thank you slide.
Excellent. Great, thank you very much, Qaiser. And a couple of quick housekeeping points I should have made at the start before handing over to Marta. First of all, there'll be free copies of the book, courtesy of the World Bank, available on the table just outside the doors as you walk out either door at the end of the event. So you can just go and pick up your own. Secondly, this event was advertised with one additional speaker, Andy Norton, also from ODI, who sends his regrets. He has a sick child at home and so couldn't be with us tonight. And so that's why we only have 4 people at the table. So, Marta.
Thank you, Jean-Paul, and thank you, everybody, for being here. Okay, I am going to comment on 3 different and quite separate issues. I'm going to say something broad about some overall comments about the book and some of the comments that Qaiser made. And I then want to touch briefly on 2 specific issues that are mentioned in the book and also in Qaiser's presentation, one of them at least, on social accountability and some of the findings, the different findings in relation to health and education and agriculture. So overall, my sort of general comments about the book is that it is extremely useful to have empirical studies of this kind where you can have reliable, good quality data over a decent period of time. In a country like Ethiopia, that you could triangulate with EHS and having, the PBS with all its history and all its, and then the size as it is means that there is a wealth of information that typically is programmatic that can actually be put to use to answer difficult empirical questions about do we know if there is a link between spend and outcomes at the local level. So I think that's a really important contribution and it'd be good to have more of this kind of attempts. The other reflection is something which is a bit closer to my heart and to my work is this is yet another example of how influential and important the WDR 2004 on making services work for the poor has been, because we are here in this room today talking about data that demonstrates causal relation between spend and outcomes, and at the same time tackling issues around do we know anything about how information to citizens is making a difference, and how influential the analytical framework that the WDR proposed, the famous triangle, has been to actually be put to use for very empirical study like this one. So moving on to some of the specific comments, I mean, inevitably I want to comment on social accountability, don't I? I just had a quick chat with Qaiser before the event, and there is work and empirical work underway developing a baseline, again, sort of making the most of the size of PBS to try to get to the bottom of how the social accountability component has worked. And this is the part of the book that deals with social accountability is the greatest, the most tangible example of the sort of the WDR influence and implication. What this book says about social accountability, I think, is a very good, it's a very good proxy for, I think, where we are with this broader debate about the importance of social accountability and governance factors in determining development outcomes, which is basically that we all recognize that it matters, but there is still a lot that we don't know about when it works and how, which, let's be careful, it doesn't take anything away from the notion that citizens ought to have a say in how budget is spent, or ought to have the information they need to be able to make choices. But it's a fundamentally different question than proving and linking, the fact that there is investment in these areas and improved outcomes. Now, there are very technical reasons why that's a difficult link to prove, and I actually don't think that necessarily, that's the only way to investigate is to do more experimental study to get to the bottom. Some are being done, and what they're revealing is a pretty mixed pictures, right? Some of the work that Bijurao has done at the bank, for example, will be an example of that, when you do, quite extensive studies that show that having citizens better aware of their rights makes a difference sometimes, but not always, and typically that when sort of the demand side of the social accountability dimension is not linked up with the so-called supply, when there isn't, and when there isn't what Bijral calls a sandwich between the citizens and the state, those effort to try to get citizens better informed and better aware of their rights and better able to hold to account remains largely not as effective as one would want it to see. So I think we all need to recognize that there are these questions on the table, that there are often very polarized debates about people who care about these things and people who think that they cannot be proven and therefore clearly don't matter. The reality is that we need to find that middle ground where we can have more informed conversation about it. And I do think that PBS offers a quite unique opportunity, because not only is a wealth of data, but is also a wealth of experience of years in a country as politically complicated as Ethiopia, try to get to the bottom of the nature of the relationship between the citizen and the state. So I do wonder whether more could be done to mine that experience of people that over the years, including Peter on my left, have been involved in the process, to question it and to try to better understand it. I mean, within that broad picture, I think that this study goes, and this is a specific contribution that it makes, and I think the study sort of tells us something about it, but leaves me wanting to know more. There is a very specific proposition here, which is that it is the decentralization of some of these processes, including the decentralization of the work that is aimed particularly around budget transparency, that is potentially making a difference. Now, that's worth, I think, investigating more, because there are a number of assumptions in some of the thinking around making citizens' voice an effective way to get to outcomes. And one of them typically is that decentralization will make that longer route of accountability between the citizen and the state somewhat shorter by bringing the state closer to the citizen. Now, I'm persuaded that this is potentially true. I think if it is worth questioning that more in Ethiopia, because of course Ethiopia is a case where there is a fairly strong central government, and if there was evidence, even if not across all the Woredas, but where the decentralization really has made a difference in the way citizens are being able to influence local level outcomes, I think that would be a particularly useful set of findings to investigate further. And I would say that the fact that so much of or an important element of the PBS was specifically looking at budget transparency and budget, around social accountability around budgetary processes, make sort of the field of investigation a bit more, a bit smaller, because typically, the social accountability spectrum can be as wide as you want, whereas you can actually focus on perhaps more in-depth studies in some of the Woredas around some of the specific tools for social accountability to try to get to the bottom of the extent to which decentralization has made a difference. The other thought I had reading this is to do with the slightly different results that are found in health and education as opposed to agriculture. Again, the reasons, there are some hypotheses in the book. The reason why this caught my attention is because at ODI, in sort of those of, in our work on governance, we've been for the last few years trying really hard to get a better handle of how governance affects development outcomes in different sectors. And one of the areas that we've investigated is whether there is anything that is inherent in sector characteristics that is likely to have a different, different implications in relation to the institutional governance factor that shapes service delivery outcomes. So one of the hypotheses we've got is there are differences in health and education, in primary health and education, and even within sectors if a program is investing in public health, is fundamentally has very different features than distribution of medicine. So we're really trying to get a handle of how these different sectors, how the technical characteristics of sectors have implications for political and governance drivers. And I do wonder whether there is something about this, the way we define services in agriculture that is fundamentally different than health and education, including in relation to the final beneficiaries, which are not citizens at large, but consumers of services of different kinds. That would be worth thinking about further. Lastly, a question to you in relation to the PBS architecture, and this is, I think, is an open question and one that we're getting closer and closer to becoming braver about suggesting, is that if we're serious about putting the social accountability and the governance thinking to better understand how and when it improves outcomes. One way to do it is to look at programming, to have an integrated approach to this. I mean, it's interesting, PBS continues to have a strand, if I understand it correctly, that is the social accountability dimension that is running parallel. At some point, the question is not just one about empirical data, is also one about ways of working and design, is whether there are ways in which all this wealth of experience around, for example, budget transparency, can be integrated within the design of a sectoral program, to get a little bit closer to the nature of the relation between them. So my proposition is that one way to investigate that problem is exposed through research, but another one could be experimenting with program design that builds some of that element into the sectoral program. And I just put to Qaiser and to others and Peter that have more of an experience around program management, the proposition, and this could be an innovative experimental way to go.
Excellent, thank you very much. And now Peter Hawkins.
Thank you, and thank you, Qaiser and Marta, for your words. The disadvantage of coming third is that everyone else has said what you wanted to say. I suppose the advantage for me is that Qaiser's gone through the economics, you've gone through all the social development stuff, so I can just tell the stories. I don't have to be academic in what I have to say. But I want to start off by, first of all, congratulating John Paul and Qaiser on a brilliant piece of work. When this was just an idea in our minds, whenever it was 2 years ago, I think, 3 years ago, I never believed that we'd actually get to this level of detail and complexity, so congratulations. But secondly, just to put it into a context, I think this decentralized service delivery has been going on maybe 8 years, 9 years with seriousness. It is at the beginning and very beginning of a much, much larger project, a project that will probably take another 10, maybe even 20 years before it's fulfilled. As Qaiser said, Ethiopia has a population of over 90 million. The terrain is inhospitable, and the different ethnic groups, 98 ethnic groups, really brings a sort of challenge to service delivery that very few other countries are probably faced with. So in many ways, it's a no-brainer to decentralize service delivery, bringing it down to the lowest common denominator, bringing it closer to the people who are actually managing the delivery rather than centralizing it. If you think about UK, which has 2/3 of the population and a much bigger infrastructure, it's only over the past 20 years that we've really started decentralizing our system with national health trusts and so on. And even then, we're not succeeding very well. So the experiment in Ethiopia has been quite fantastic. While recognizing John Paul and Qaiser, I also want to recognize the really hard work that people on the ground in the Woredas and in the regions have done. And their inspiration for many of us, and I've known, as John Paul said at the beginning, Ethiopia for a long time, how hard these people are really trying to put this plan into action is quite phenomenal. And at a central level, how people in central government are really trying to stick to the principles of decentralized service delivery is trying to do. And because Bene is here, but people like Bene who spent years and years, much longer than me, actually working really hard to make sure that this project in actual fact works. So there's a lot of people behind that. And I want to, slightly like you, bring up 3 issues, as I always do. Accountability, then the results, and then a little bit about the emerging regions where there is a black hole in it. Accountability, when I won't say how long it was ago, but a number of years ago, if I told you, not only give away which regime was in power, but also my age, and I'm sure you don't want to know how old I am. Was sitting observing a group of farmers in a discussion in their association. I was with a senior Ethiopian politician, and we were talking about why Ethiopia is so fantastic, why Ethiopian people were so hardworking and perseverant. And in that conversation, he turned around to me and said, Ethiopian people are really really fantastic because they do exactly what you want them to do. When you talk about accountability, if that's not top-down accountability, then I'm not sure what is. And so the challenge around accountability in Ethiopia is massive. But when you go there, as you said, Marta, you see the budgets posted on the health centres in the Warada places. You see a discussion taking place. You're beginning to see, with land tax, that the accountability is coming through the sustainability of resource mobilization at association level, Warada level. And it's, the changes are palpable, I think. You can see where people are now beginning to demand the service, but not only what service that they require, but the type of service that they require. Committees, parent-teacher committees in schools are a force to be reckoned with in many parts of the country. The results, and again I'll start with a story. A couple of years ago took my children up to Lalibela and we sat by the marketplace. It was a Saturday afternoon. A market was working and this farmer was walking in from the countryside. With my children I started talking about that farmer. That farmer looked the same to the farmer that 20, 30 years earlier that I sat in the same place during the Ethiopian famine and watched a farmer of a similar type coming in, slightly for different reasons. The market was of the same size and the same produce. The only difference was you got one section of the market which had expanded into Manchester United, Arsenal, and now the Premiership football shirts. But if you ignored that, the rest was exactly the same. But in talking to my children, because they were berating me that in the 20 years of development in Ethiopia I had achieved absolutely nothing if that farmer was the same. But in actual fact, when you looked and analysed the prospects for that farmer today is 75% chance that he would own his own ox to be able to farm. That farmer's wife would probably be alive, whereas 20 years ago he would be on his second or third or fourth wife. The child, especially the under 5 child, is more likely to be alive than dead. The children were at school, as it turned out. And so the prospects of that farmer has changed immeasurably. No longer is he working from day to day, is the family surviving on a day-to-day basis. They are developing in a way that was unimaginable 20 years ago, and that is because the services now were available. Only in 3 years, the immunization rates have gone up from 85 to 88%. There are 21 million children in school in Ethiopia. That is a population of many entire countries. 92,000 teachers have been trained and deployed. The absentee rate in teachers, while it's variable throughout the country, can be as little as 7%, which is quite phenomenal in parts of that country. So for the real lives of people, their prospects today are completely different to what they were 20 years ago. But there's still a long, long way to go, and decentralization will only improve the likelihood that those prospects will materialize into real gain and real reduction in poverty. But I suppose the area of greatest challenge, I think, is around the emerging regions. Emerging regions, Somali, Benishangul, Gumuz, Gambela, and the Afar region make up probably about 10% of the population. And yet in Somali region, for example, the enrollment rate is less than 50%, whereas in other regions it's up to 88, 89%. And it's there, I think, where decentralization in itself is not, well, what else needs to take place? Is it sufficient or is it not sufficient? Well, how can you reinforce the management structures to ensure that the service delivery continues to meet accountability standards and standards of quality of services that would allow people to not only benefit from them but demand more from those services. Gambela, with a population of 300,000 thereabouts, and its size of, I think, Wales, or if not bigger, you've got real challenges of how do you bring about services into those areas. But I think more particularly is the advantage of decentralization is you devolve the management down to the lowest common denominator, and that management continues to be weak and will continue to be weak for a long time to come.
Great, excellent. Thank you very much. You don't have any reply. Should we just go straight, or do you? Should we just go straight to questions?
Yeah, go straight.
Let's do that. Let's do that. Okay. So let's take questions for anyone of the panel. If your question is for one person in particular, please state that. Otherwise, we'll assume that all the questions are answerable by everyone. Yes, over here in the white shirt. Yes, sir. We have this roving mic. So there we go. Yes.
Thank you, Chair. I'm really astonished from what I'm hearing from the floor in terms of, am I sitting in an academic institution, or is this a political discussion? By that, what I mean is, yes, there are big headways that have been made in Ethiopia in terms of growth. I wouldn't use the word development, because in most human or otherwise indices, Ethiopia is still at the bottom of the world. My biggest question is the other side of the story that has never been told, which there is an opportunity to make this even better. What is basic services without basic right?
Okay.
So that doesn't exist in Ethiopia. Don't take it from me. All independent organizations say that. That is the case. World Bank, I have never heard of them saying we have failed anywhere in the world that they have been to. For a country like Ethiopia, where the last over 10 years that we have been pouring over $5 billion a year and start from a low base, it is not surprising that we are making a lot of improvements. But we could have made how much? The link between rights, accountability, governance, and change in terms of outcome. That link has been severed, and the World Bank wouldn't say anything about that. And I can tell you from my first-hand experience, if you're telling me there is that much accountability at a local or whatever level, this has never, why hasn't that never translated nationally?
Okay, thank you for that. There's some other questions, so let's take a couple of other questions, and we'll round them up. Yes, in the blue shirt back here, please. And then we can take three at a time.
Thank you, Chair. I believe earlier this year that the Transparency International said that Ethiopia was the least corrupt nation in the African states. How does your model of decentralization work within more corrupt nations, really, in terms of effectively driving political and economic systems in order for distribution of wealth equally between sort of different, the lowest 40 percentile, really? How do you see it? How can you effectively manage that process?
Right, okay, good, thank you. And gentleman down here in the front, on the aisle, yes.
Thank you very much. I was particularly tickled in the presentation when you made the point about the approach to decentralization in Ethiopia, where you said that even the small ethnic groups can actually demand for a district and they get it. In your opinion, do you think that is a positive thing? Do you think it increases the effectiveness of the decentralization process itself? Because I saw there are ethnic tribes in Ethiopia which are as small as 1,000 people, even less than that. So can a district actually be granted for those groups? And doesn't that therefore move people further apart rather than promoting national unity and integration and so on and so forth? Then other two small points is on how sustainable are all these gains that you have talked about, because I see it is 50% externally funded. Is the World Bank and other European donors going to be there forever, or should we assume that they will get there one day? Is there something from within Ethiopia to show that they are able to take on this, even if there is no donor money? And on participation, it's different to put information out there and whether actually people are making use of it. You said about 270,000 people have been trained. That is less than 0.3% of the population of Ethiopia. So is there actually effective participation of the people, or it's just a system that is somehow being put there to be there?
Okay, thank you. Let's let Qaiser answer first, and then I'll let our other panelists.
Okay, what I love about Ethiopians is their enthusiasm for the country and their love of their country. And thank you very much, and your points are well taken. I wanted to stick here to empirical results, triangulated by results, not just official data, but using independent survey data. And I'm sticking to that. I'm not getting into the rest of your question. And you can have a private discussion about that afterwards, right? For your question about whether keeping small groups having their own wordas, is that feasible? Well, it's there, but very small groups don't ask for it, right? So, and in terms of the sustainability of 50% of the money coming from donors, it has been actually going down over time. It used to be over 75, it's going down to 50, and in the next phase will probably go down to 30. So there is a change in dependence. Okay.
Okay. Marta, do you have anything to add?
Yes. I think there are a couple of questions that touched on decentralization, different elements of it. One is, how do you do decentralization in a country that is more corrupt, or where the central government is more corrupt? Well, the reality is that it doesn't work that well. I mean, I think Peter touched on that at the end of his comments. I actually don't think, and this is not specifically about Ethiopia, I don't think there is anything inherent in decentralizing management structures and political decision making as well as spend that in and of itself resolves the drivers of corruption or of political instability. And I do think that there is a problem, as it is often the case in international development thinking, that we hang on to these solutions that are meant to be working everywhere. And I do think that there is a problem with the way in which decentralization is implemented, particularly in very fragile or sort of in unstable or weak, where there are serious challenges around management of resources, with the idea that if you then decentralize them, the problem disappears. We've done quite a lot of work in Malawi that demonstrates very clearly that there is nothing that inherent in decentralizing that has made any difference in relation to improving those structural conditions. So I would agree with you. I do think that, I mean, the data from this exercise demonstrate, or seems to suggest that there is something in elements of particularly on decentralizing spend, that has had effects, which one needs to take as at face value in terms of that having happened. But I think it would be a mistake to generalize about the success of the model. And this goes to your question. I'm not at all an expert on Ethiopia. On your questions about linking rights to outcomes, well, we can't. And in a way, this study doesn't. And I would agree with you that there are big challenges to human rights violations in Ethiopia. However, those of us who try to get a handle of what determines human rights outcomes in different places, I think there are examples in Ethiopia, and the other obvious one in Africa is Rwanda, where there are, for some of the reason that maybe you outlined, because we started from a fairly low baseline, but where there have been clear examples of improving in human development outcomes, where, in the face of fairly authoritarian regimes being in power centrally. I mean, I think that's not, something that we need to be able to discuss. And in the same way that we should be very careful not to assume that because there have been improvement in outcomes, this has made any difference to the situation of freedoms and individual rights. So I think it's a question that is worth posing from an empirical point of view, and I think it's important, it's important to take studies like this for what they offer into some deeper analysis of what happens with specifically linking spend to development outcomes. And I think I'll leave the question about levels of aid and donor to Peter.
Just taking up Marta's last point and your point, I mean, we are discussing decentralized service delivery here, and I mean, you're right, you've got to look at the wider picture, and I think the issue of sustainable decentralized service delivery will be challenged more and more as the situation evolves because of issues around rights, governance and accountability, and I think those are all things that are discussed and raised, and people are trying to affect change to bring a positive outcome there. But the issue of sustainability, I think, is the key with a lot of this. And you talk about the funding. The funding in itself is I think, less of a problem. The greater problem is whether the government will stick to the policy, and I think that is there. So what we've done with the government is bring about a study around sustainability, so that in 10, 20 years' time, because as I said, it's a long-term project, the outcome of this is sustainable for the people of Ethiopia and the government of Ethiopia, wherever that is. So looking at issues around taxation, looking at issues around prioritization in development over the next few years, and so on. Corruption, I've had the privilege of working in some of the most corrupt countries, and looking at some of these issues there bring about certain challenges. But there is also an opportunity that you can use decentralized service delivery to look at public financial management, look at the way that public financial management can be ring-fenced, and I think what we've seen in Ethiopia is it can be, and how we can replicate that model elsewhere is going to be challenging. I wouldn't do it in 80% of the countries I've worked in. I would look at a completely different model, but each country has its own way of working, and corruption is an obstacle to decentralized service delivery.
Great, thank you. So, more questions. Who else? There were more hands up before. Yeah? Yes, the lady in the very back. Okay.
Thank you. My first question is about your excellent statistical study on Ethiopia, please. And I want to know about the spatial variation of Warada expenditures per capita.
I'm sorry, can you speak up a bit? We're having trouble hearing you. You want to know about spatial expenditure?
Spatial variations
spatial
of
variation expenditure.
Warada expenditures per capita. I would like to know if you can aggregate your data on a regional basis in order to determine which region has the biggest bang for the buck. Specifically, I would like to know if Region 1 is doing better per capita than other regions in determining the effect and the outcome per dollar. Will
Good.
you be able to tell me that? That is my first question. My second question is for the gentleman from DFID. I would like to know, please, why you are using the term emerging regions. Emerging from what? And I note that the emerging regions, Somalia, BG, Benishangul Gumuz, and Gambela are all either oil or gas producing regions, as opposed to other regions that are agricultural based. What is the criteria for being an emerging region? Thank you.
Okay, thank you. I think the gentleman, yes, the gentleman next to her had a question.
My question is about, I don't remember his name, this man. He told us that Ethiopia has been improving and improved for last 20 years. But on the other hand, I read a report written by the Oxford University, which puts Ethiopia second last poorest country in the world. Only Niger being behind Ethiopia. We know Ethiopia, I'm an Ethiopian. Ethiopia has been poor all the time, but according to these statistics, which Oxford University shows, it is going from worse to worst. But would you say, including also you mentioned peasant talking, met you around Lalbala. I think maybe your study depends on the person whom you talked, or it's a reflection of the economy of Ethiopia. According to the Oxford University, 93% are going low, only 5% going high. You can read that is 2011, which Oxford University produced. But I don't know, maybe the different angle people are looking. Whom can we believe then? You told us it has been improving for the last 20 years. Thank you.
Great, okay. And maybe one more down here, the gentleman in the front. Okay, and then I'll come to you next round.
Thank you very much for the opportunity. In the presentation, you said that all financial transfers are made public for even in local languages for people to see and all that. I'd like to find out that tying that in with the leadership at the Warida level, how are the leaders at that level appointed? And I ask this because if the local people, let's say, if vote for them to be there, there's an extent to which they can voice out as far as that financial, let's say, accountability is concerned. But if they are appointed at the central government or at the regional level, as you told us, then they may not even listen to the local people, so they exposing accountability of the finances, will just be just addressing. It wouldn't make much difference in the Warida level. I don't know if I mentioned the word very well. Thank you.
Okay, thank you. Qaiser, would you like to start?
Yeah, on the first question on regional variations, if you look at most of the data in Ethiopia, you'll see regions are converging with the exception of Somalia and Afar in outcomes in health, education, in all these areas. And some of the problems in Somali are probably due to the pastoral nature of the population, because the services are stationary, the population is not. So that's something we look at, that divergence. But as we are finding out over time, the pastoral population are getting less and less pastoral. Nowadays they keep the older people, the women and younger children in a fixed location. Over time they're coming back, so that'll be one way to move forward. But generally, the gap in Ethiopia now is actually among lagging waradas, which are all over the country, not just in the less developed regions. For example, just give you one example, the net enrollment rate of the bottom 10% of the waradas is about 15%, right? This is waradas average for the bottom 10. And these waradas are in every region of the country, compared to the national median, which is similar to the national mean we pointed out earlier. So there is a geographic divergence, but it's no longer at the regional level, it's at the warada level, right? So we have to look at it. The question on financial transparency and governance issues, yeah, Ethiopia is modeling itself after China as a development state. Local officials have to manage upwards, which is the question you're making. Then how does that make them responsive to the local population, right? That's what the question was? Okay. They manage upwards, but because the government is trying to stake its legitimacy on getting results, local officials' performance in getting the results is a big factor in whether they move upward or move out or move downward. So there is a results-based accountability, but even if they're doing upward management. So there are a lot of strict targets given, lots of things have to be delivered, and also a few things have been happening in more recent periods, which means that maybe in 2-3 years' time, they will have more structured response mechanism in every district of the country now, every warada. So those structured responsive mechanisms are useful because social accountability allows people who have less voice to be able to voice because they're sitting in a structured system. I think most of the questions were Peter on this round, if I recall.
I would agree with you, the term emerging. I was just being consistent with all the other documents, but there are 4 regions in their own right. And I think the issue there is that those 4 regions, more than any other regions, have been under-resourced in terms of service delivery. And it's only recently that some of the resources are now being put in place. In terms of poverty and Ethiopia, as you quite rightly said, is one of the poorest countries in the world, and it will remain one of the poorest countries in the world for a long, long time. As I said, this is the beginning of a long-term project that Ethiopia is going through, and its success will depend on how long it can remain stable and invest in service delivery at regional level. Ethiopia probably will meet most of the MDGs, but so will many other countries. Which is an indicator that the tide is perhaps changing. If you take the Central Highlands of Ethiopia up to 2004, 2005, decade on decade, destitution actually increased. Since 2005, with service delivery becoming more and more prominent, access being increased immeasurably, things are beginning to turn around. But it will take a long, long time before Ethiopia can come out of poverty, and there will always be pockets of extreme poverty in the country for decades to come.
I actually want to go back to a question in the previous round because I forgot to mention your questions about the fact that there is a difference in talking about participation in terms of that being provided or being in place. You mentioned trainings taking place and those not being necessarily the same as participation working in practice. I would agree, basically, and that's what I meant earlier in my comments. I think there is a genuine open questions that need to be addressed about the extent to which social accountability interventions are effective. My take on it is that there is a limit to which that question can be an empirical one that can be answered by data and research. Some of it, I think, needs to be experimented with, particularly for this work at the local level, when you try to actually put in practice the social accountability measures alongside other forms, other tools to try to improve outcomes and see how in connections they work. But I would agree with you that there is a problem if we continue to talk about social accountability as something that works in principles and and is just done in terms of activities. But I do think that there is potential in this work at the local level to get a better handle of it, and I do wonder whether on these discussions about the actual differences, the variations between region, including on some of the different political settlements and political structures that exist within those regions, there is scope to get a better sense of the differences between regions in relation to where social accountability works better than in other.
Great, thank you. Let me interject a couple of quick observations because I'm a co-author on this study as well. I like the lady's question very much at the beginning of this round about which region gets the more bang for its buck. We can answer that question. Unfortunately, I can't answer it right now because I can't remember exactly, and I don't want to lead you astray, or I think I can remember, but I may be wrong. But we can find out immediately following this event because it's in the annex of the book, where you can see regional decompositions of investment funds and also regional
Results too.
Yeah, and results, exactly. And so regional dummies that measure the marginal, the incremental effect of the marginal dollar, let's say the marginal beer, on education results, health results, and agriculture results. And you can see that the answer will be 2 or 3 regions for education get more bang for the buck, and perhaps a different 2 or 3 regions get more bang for the buck in health. And that in itself is interesting. And so that gives us sort of more grist for the mill for further investigation. If I can comment on something that's come up in several questions about corruption, decentralization is a field that I've been working in for a long time, as some of you know. And I'm happy to tell you that there are exactly 3 things that happen with respect to corruption when a country decentralizes. One is that the local governments and the regional governments are comparatively less corrupt than the central government was before, and so corruption gets better. The second possibility is that the regional and local governments are more or less as corrupt as the central government was before, and you don't get much change. And the third option is that it gets worse. And all of these things happen across the world. I very much agree with Marta that there isn't a single linear response or a single linear prediction about what will happen when you decentralize vis-a-vis corruption. It could get better, it could get worse, or you could get broadly no change. And so these reflexive policy recommendations about decentralizing because the following will happen are silly, and it's good that we're getting away from them. The interesting analytical question is why in some countries, or even within countries in some regions and some woredas, you have far more honest, far greater probity of government than you had under centralization when a country decentralizes. And in other regions and woredas within the same country and within the same decentralization program, it gets worse. And that's the kind of space where I think there are going to be 1,000 studies launched in the coming couple of decades, and some of you LSE students could be amongst those who do that work. Next round, there's a question here. Yes, gentleman here in the striped sweater. Lady.
Thank you. My question is actually a question to the sustainability of the model again, and to what you just said. Because I was asking myself if the 50% are funded by the World Bank or by other donors, if the 50% are gone, why would the government stick to that, to this decentralization? Because decentralization means usually that someone gives up power, like the local governments gain power and the national governments gives up power, and usually no one likes to lose power. So how can you make sure that they don't try to get back the power and reverse the decentralization? If you know what I mean.
Okay, thank you. Who else? I saw hands. Is there a hand up over here? Yes. The lady down here in the... There we go.
I think as a witness and a participant into a part of a humanitarian mission on what is defined as non-governmental structures, say organization, although actually they might be much more governmental towards the risk taken, towards the factor of investigating locally how the funds would be actually exploited or not in structural adjustment towards a familial structure or within the education program about quality of psychological approach of education of children within a wish of integrity into the principles, and how from here on the mainstream national media, how do we perceive this, for example on Al Jazeera and things like that, is something that is very intriguing, because we can notice that even in media journalism there's a lot of curbing or dissimulation within what would be local skills provided to people who have a workforce hardship that is much harder than other jobs. And even here we have people who are my friends who are from Africa. They have very hard jobs, but they don't have a psychological support that is the same than people who can access a school like here. And that I think it's a shame.
Okay, thank you. Oh, yes, okay. Sorry, over here on the side, and then we'll get in the gentleman as well, and then that'll be, I think, the end. The lady on the purple, blue, on the blue. Yes, right on the edge.
Thank you very much for a very interesting discussion. Just one comment and then a question. I think looking at different livelihood groups, I don't know if your report actually breaks rather than by ethnicity, but looking at specific livelihood groups. I mean, is the information disaggregated within Waradas between different kinds of livelihood groups? Because all over Ethiopia you have agro-pastoralists, pastoralists, horticulturalists, farmers, urban, etc. So I'm just wondering, A, if it's disaggregated like that. And so that's my main question, yeah. Thank you very much.
Great, thank you. And over here on my left, please. Yes.
Thank you for finally coming to me.
You're most welcome.
I just I wanted to say that really for everyone on the panel, that it's really important to exercise at least some level of due diligence if we are to interfere in the life of people. In the life of people whose social structure, political structure, we don't fully understand. Qaiser spoke about social accountability. He doesn't properly explain what he meant by social accountability, but it seems to me what he calls social accountability is actually a technology of control, not social accountability. I am from Ethiopia and I lived all my life there. Now I teach here. And the image that is being depicted here is really very difficult to understand for anyone. I'm not saying that there are no changes in Ethiopia. There are changes, definitely. But I would really be interested to actually understand how much of that data comes from the government. And if the government is clearly authoritarian, which I hope most of you would agree, what is the legitimacy of using this data insofar as this is the government that justifies its own legitimacy as a government on lifting people out of poverty? Because it has to deliver results, as you said, I agree with you, and insofar as its own legitimacy ultimately rests on this fact, how do we trust this data? So I would really be interested to hear how much, in terms of percentage, does this data how much of this data comes from the government, and why is it that you can't gather your own data rather than relying on the government's data? Thank you.
Do you want to start?
I'm not sure. The last question, yeah, I got this at the University of Addis Ababa when we made a presentation too about you're taking the government data to get results which make the government. Yes, I remember I mentioned at the beginning, we triangulated the government data findings with data from DHS, which is generated independently by US-based organization, and the same model is used in every country to collect the data and test the data. So we have tested the results we found here with the data, and in fact, one slide I showed was actually just DHS results. So I'll leave the data question rest. As far as the political economy question, this is for you Ethiopians to work out among yourselves. I'm just going by what the data is telling me, and I'm trying to, and I've told the researchers at the university, others who are skeptical of some of the findings, take the database and do your own analysis, right?
But you are making an intervention. You need to justify intellectually. And you can't write a book and then say that is for you.
Sorry. You don't want any education or health service in Ethiopia? That's fine. That's the other always saying, do this in that way. And so let me answer the other questions, because I think I don't want to get into political economy questions and I'll spend all my time on those issues, right? Now, there's a question on livelihoods and how that interprets results. Yeah, one of the issues of what you have with livelihood patterns is that we are actually trying to generate the data now in the next round, and we are having independent surveys done to look at livelihood patterns and livelihood issues, right? And how that affects some of the results. It is very clear from the anecdotal evidence that if you're a pastoral population, if you go to the pastoral areas of Ethiopia, you'll have very high school enrollment rate in the beginning of the year. Then the grazing season starts. Most of the boys drop out. They go off grazing. Again, at the end of the year, you have a very high enrollment rate, right? So if you do not look at it in a seasonal basis, your data, snapshot data, beginning of the year, end of the year, will not give you the right results. So that's why you have to look at these questions by talking to households and not using administrative data. That's why we're trying to generate some of that data. There's a question also on the question that you had, most of the points you make are great, and I said in the beginning, development is about choice, right? And if you look at people, Ethiopia is still a very poor country, as I know. The results are there. It's still a very poor country, and it's starting from a very low base. But if you look at the reduction of poverty in Ethiopia, the three factors that reduce poverty in Ethiopia in the last decade or so show are, first of all, broad-based agricultural growth, which is small-scale agricultural growth, which is what Peter was talking about in his anecdote, right? That results are confirmed in the rounds of, we looked at the independent service for that. The second factor has been, if you look at Ethiopia, if you look at the history of the last 40 years of Ethiopia, and the most characteristic factors in Ethiopia has been the story of famines, recurrent famines, and mass starvations, right? The frequency of that as a national scale has gone down, and there's still localized problems. We're not saying it's rosy, right? But one of the reasons for that has been a massive effort by the government and by Ethiopia's development partners to fund food security safety nets which react in advance of a crisis. So if you looked at the last Horn of Africa crisis, Ethiopia, which would have the highest impact on normal drought in the last, had the lowest impact because of these organized programs. It is not just the government alone, it's the Ethiopian communities, all of them working together to rehabilitate the mountainsides, to reforest the hills, which is helping improve productivity and reducing the risk in that area. And the third factor has been the improvement in service deliveries. These are the three things driving poverty reduction in Ethiopia. It's still a long way to go. Okay?
Instead of the vaccinations at 6 months for the baby, you would give that free orange juice, but there's quite real orange juice and renewable. What do you think?
I'm not a nutritionist, but I'm sure my nutrition colleagues would agree with you. And there's a micronutrient program UNICEF is doing right now, is looking at some of those issues. Yeah. In terms of the question whether the federal system will sustain without donors, this federal system was built up without donors telling them to do it. I mean, it is in the Constitution of Ethiopia, and it's a constitutional obligation of the federal government to provide funds to the regions and waradas. And in fact, there's the House of Federation, which is a separate house, which actively monitors it, right? And so I think that takes care of all the questions, yeah.
We also had questions on sustainability and livelihoods. Marta and Peter, I don't know if you have anything to say about that.
I mean, on the sustainability of the model more, so back to decentralization. I mean, Jean-Paul is the expert here, and you already mentioned how, you know, there are a million different versions of it. But one of the problems, what you said about the fact that what qualifies decentralization is the transfer of power and its sustainability over time, is precisely one of the variables that you can't assume to be there across the models. And there is plenty of example of decentralization without meaningful transfer of power, some of which I think have, in some cases, has been to some extent donor-driven or donor-inspired, but for whatever it was coming from, the idea that there is a model for transferring power that is likely to be sustainable is very much not what happens, and is what determines the three different outcomes. That is one of the variables that determines the three different outcomes that Jean-Paul mentioned. And in fact, it's very common that transfer of power doesn't happen or doesn't happen as planned, and it does not trickles down to the local level.
Just on sustainability and your point about data, and you make a valid point, but I think this study, which is right at the beginning of a long-term evolution of service delivery, is saying that the model, having triangulated data, the model of decentralized service delivery seems to be working. It's not saying it has worked, it's finished, it's done its job. It's right at the beginning that there are positive indicators of it working. Accountability has a long, long, long way to go, and social accountability especially. And until that emerges, the model itself won't be proven to have worked and succeed. There are a lot of issues that need to be addressed: the quality of services, the cultural relationship between the communities and the services, and so on. Those won't happen overnight, and they need a lot more time to take effect. Just on a wider thing, on the issue of the amount of external and internal resources, there's something called the additionality test, which every 6 months is looked at. And that's to ensure that the Ethiopian government contribution year on year continues to increase and is ahead of the external resources that it bring to bear. And the whole point of that is to ensure that over the next 5, 10, 15 years, that Ethiopia's own resources start to dominate and in the end overtake the substantial amount of resources required for service delivery in Ethiopia.
Great, thank you very much for that. I'm afraid we've gone just over time, so it remains for me to thank Qaiser Khan, Marta Foresti, and Peter Hawkins for a very interesting, lively session, and thanks to all of you for sticking it through to the end.